Hi, I'm Dr. Douglas Street. I'm a medical doctor, and this video is going to be looking at how you can avoid hypoglycemia when you're on your diabetes remission journey. Now, remember, diabetes remission is about getting your blood sugar back to normal off medication. Now, depending on how you go about it, you may end up with your blood sugar going down too low. I'm going to share some tips with you to show you how you can avoid that from happening. Well, first of all, what is hyperglycemia? Hyperglycemia is referred to as low blood sugar. Now, this is when your blood sugar falls below 4 millimoles per liter or 70 milligrams per deciliter. Now, some authorities may use a lower figure, such as 3.5, but usually what happens is that you don't usually get symptoms until the sugar goes below 3 millimoles per liter. And when you get down to levels like 2, then you may start to become unconscious or confused. So, so it's important to be aware that this is something that can happen. Now, this is usually likely to happen when a person is pursuing diabetes remission and they're on medication. Usually, if a person is not managed with medication, this is not likely to happen, right? But when you combine the dietary changes, exercise, taking supplements, and making lifestyle changes, then you may find that the blood sugar may go down into the low range. So this is something that you really want to try to avoid, because hyperglycemia can cause significant problems. Now, what are some of the symptoms of hyperglycemia? These include things like shakiness or nervousness, tremors, sweating, rapid heartbeat, dizziness, lightheadedness. You may find that you get excessively hungry. You may become irritable. You may get confused, difficulty concentrating. You may start to feel tired. You may start to have blurred vision. You may have headaches, nausea. And as I mentioned before, when it gets really low, then you can become unconscious and you might even have seizures. So if you have diabetes, and especially if you're working towards remission, and you start to get these symptoms, it is important for you to check your blood sugar to make sure it's not going down too low. Now, one of the key things that you can do to avoid your blood sugar going too low is to monitor your blood sugar regularly. And this will depend on individual factors. And I said this is more important if you're taking medication. This is when it usually happens. And when you monitor your blood sugar, you can make better decisions about what you're doing. You can also see how your blood sugar responds to certain situations, such as when you make certain dietary changes, or when you undertake certain lifestyle changes, and you monitor the sugar under those conditions. You can see how your sugar will respond to those situations, and you're informed thereby. Now, of course, when you're checking your blood sugar on a regular basis, you have to make sure that you have your supplies ready, especially if you're going into a weekend, or if you're going to a place where you may not be able to access these supplies. You have to make sure that you have them with you at all times. And it's not just your testing supplies. You also have to keep foods and so on that can help you to treat it in case it starts happening. Now, another very important thing that you need to do when you are pursuing remission and avoiding low blood sugar is to make sure that you consult with your health practitioner when you're going to undertake diabetes remission. And this is something that we spoke about several times. I just want to highlight it again here. Now, it's important to have your health practitioner be aware of what is happening so they can make certain changes or tell you when to make certain changes. Now, one of the things that we encourage is that when your blood sugar starts to get down to 7 millimoles per liter or 130 milligrams per deciliter, that is when you want to start making changes to your medication. This might mean that you may cut down on the dose of your medication if it is not already towards the lower end, or you may want to stop taking a particular medication. And your doctor will tell you, if you're on several medications, which medication to stop first. Right? So partnering with your health practitioner is very important to stay in the safe zone where that is concerned. Now, another thing that you want to keep in mind is that be careful about drastic changes that you make to your diet or lifestyle. You know, these can cause rapid changes in your blood sugar, so you have to really be careful. You may not want to make too many changes all at once because you want to see how each change is going to affect your blood sugar, and so that you don't get down into the lower levels. So so it's best to do them gradually, you know, do one at a time. Add exercise, dietary changes, etc. on different days rather than everything all at once, right? Now, when you're making any kind of change to your diet and lifestyle or medications or adding supplements, it's important to monitor your blood sugar at those times to see, you know, what these changes are doing so that you don't end up with your blood sugar being low. Now, there are times that you may end up in some unexpected situations. Let us say, for example, you're going to an unfamiliar place. You're trying to work towards diabetes remission. You're going to an unfamiliar place, and you may have made certain plans that have not really worked out in terms of eating. So when you're going into those situations, those unknown, it's best to carry some food with you to ensure that if you don't get to, you know, where you are expecting to get to at the time that you're expecting to get there, then you won't end up in a situation where your blood sugar goes down low. So make sure you carry food supplies with you on those occasions. Or you may end up doing a bit more physical activity than you had planned. Let us say you're going on a hike and you might have not expected to last that long. It's important that you keep supplies with you, you know, blood sugar testing and also food and so on, to ensure that you can have access to these things if you end up in an unexpected situation. Now, one thing you always have to keep as well is emergency supplies. And apart from the blood sugar testing supplies, you also want to keep snacks with you and even glucose. Now, you can use the snacks if you know you're going into, if you're in a situation where you can't access food as what you would expect. But don't use glucose in that case. What you want to save your glucose for is if your blood sugar is actually going down low, right? Because glucose, you know, has its issues, as you well know, which is why we're trying to get your diabetes into remission in the first place. So don't use glucose except for emergency situations. And when you're in those situations, it's always best to inform those around you. If you're with a group, for example, just let them be aware of the situation so that if your blood sugar starts to get low and you start becoming confused, they'll understand how to go about it, you know, giving you something to eat or giving you glucose, checking your blood sugar to ensure that you stay on the right track. Now, in conclusion, hyperglycemia is something that, you know, it can cause a lot of different problems. Apart from those effects that we spoke about, if your blood sugar keeps on going down low, it can actually affect your heart. So hyperglycemia is something that you really want to be aware of. It's not something to really say that you're not going to pursue remission. Just be aware of it and make sure you take the necessary steps. Be proactive. Make sure you keep on monitoring your blood sugar. Make sure that you make the appropriate dietary choices. And of course, collaborate with your healthcare provider so that you can give guidance in terms of, you know, when to make adjustments to your treatment. Now, as we wind down, we also want to have a look at 1 Thessalonians 5 verse 7 from the New King James Version, and it says, "Therefore, let us not sleep as others do. Let us watch and be sober." Now, that word watch is a fairly common word that is used in the Bible. And it really speaks about being aware, being alert. Now, when a person is alert, they are watching what is going on around them. Now, watching what's going on around you will inform you as to whether you're in danger or not, right? Pay attention to the situations that you're going into to see if they are high-risk situations, especially at a spiritual level. You also want to pay attention to what's going on around you generally in the world, because as we look around us, we see the changes that the Bible spoke about in terms of the end of the world. Now, as you see these different changes going on around us, we'll want to make changes to what we are doing, right? If you see that you're going into an unsafe place spiritually, then you want to stand back, reevaluate the situation and make some changes. If you realize that when you look around you, the signs of the end of time is coming to an end and you are not spiritual in the right place, then you'd want to also look into yourself and realize that you have to make changes so that you can be ready. Now, it's the same thing with hypoglycemia. You want to make sure that you watch the signs, monitor yourself, see what's going on around you, and make those changes. So, be sober, be alert, and make adjustments accordingly. Thank you, and see you in the next video.